Hi, I'm Aaron Dean, and this is Advocate Today. Wildfires are becoming a more common occurrence. In the last few months, many parts of the country have been hit with smoke from these wildfires, causing skylines and neighborhoods to look like something out of an apocalypse. And unfortunately, it can be the new normal going forward. Many scientists have been warning of the rise of wildfires, but the issue is now arriving at the front door of Americans. Air quality index readers have hit record highs in recent months due to these wildfires, leaving many people indoors or wearing masks. And areas that don't normally experience the impacts of wildfires are just as likely to be affected versus areas where it's more common. We're seeing wildfires all over the world right now. And even here in the States, many areas have been hit with the wildfire smoke this year, multiple times during this year at that. Can you share with us the latest on what you're seeing when it comes to all of that and how all this came to be?
Sure. So you're absolutely right that we're seeing one of the worst wildfire seasons on record already. And so this is, I think, unfortunately, a bit of a taste of what's to come. So as climate change is intensifying, we're seeing increased temperatures, more drought, and this can contribute to basically drying out vegetation, grasses and trees, which then can fuel these wildfires that we're now seeing. And like I said, unfortunately, we expect this trend to continue into the future as climate change worsens.
Are there other parts of climate change that are impacting this? I know you mentioned the heat is causing, things to dry out, which, when things touch, they brush, it kind of sparks fire. But are there any other parts of climate change that's impacting this?
Yeah, so lots of factors involved in what's going on here. But one other thing to think about is climate change is resulting in our weather patterns being less stable. So actually, one thing that can be problematic is if we get a lot of rain early in the year, and that can lead to kind of a lot of ground cover sprouting up. And then if we don't get much rain, that all dries out and creates kind of this perfect fire starter that you might use to light a campfire or something, for example. So it can really, this variability in precipitation, in addition to increased temperatures and drought, is also part of what's going on.
Many people are referring to their air quality index readers these days. Can you explain exactly what those readers are and how air quality is measured?
Yeah, so the air quality index, or the AQI, is supposed to be an interpretable way to give people an idea of what the air quality is like outside. The one you're probably most interested in when thinking about wildfire smoke is the fine particulate matter, or PM2.5 AQI. And so when you look at those numbers, you can see, I believe if it's less than 51, that'll indicate the PM air quality is pretty good and you shouldn't be too worried about going about your normal activities. When it gets a bit higher, let's say above 151, then restricting activity, staying indoors, using air filtration systems might be something you'd want to do.
And, when we look at the impacts that, air quality like this, when it comes, whether it's from smoke coming from other places or things like that, when we look at the impacts on the human body, what are those impacts? Of course, we can't see when we go outside because it's hazy, but there has to be some others, right?
Absolutely. So we're in pretty early stages as a scientific community in terms of understanding how wildfire smoke affects health. But so far, what we know is that being exposed to wildfire smoke at higher levels for 1 to 3 days increases people's risk of going to the emergency department or being hospitalized for a respiratory disease, something like an asthma exacerbation. We think that this is happening because particulates get into the lungs, actually get embedded in the lung tissue, which creates inflammation, oxidative stress, and can result in things like an asthma exacerbation. Other things we've seen going on are these short-term exposures, a couple days where levels of air quality are really bad. It can be bad for cardiovascular health. It also can increase the risk of adverse birth outcomes in people that are pregnant during a wildfire event. So it speaks to needing to stay indoors, try to use a mask, protect health when some of these events are going on.
Also, too, sometimes poor air quality can have greater impacts on some populations than others. Can you share a little bit about what communities are more at risk than others are?
Absolutely. And I think this is a really important point. Not everyone that has the same level of exposure will have the same response. And that's because some people, because of underlying health conditions, because of their size, for example, we think children might be more at risk from these exposures, might have worse outcomes. We also have to think about some people don't have the ability to be able to stay indoors and protect themselves from wildfire smoke. Some people, their jobs are outside, and to go to work, they have to be outdoors where this smoke exposure is much higher. And so that can also really increase risk of adverse health outcomes. But we've seen in scientific studies that it looks like older adults, potentially children and pregnant people, might be at elevated risk of adverse health outcomes during these smoke exposure events. So we, in particular, really want to look out for those folks.
And, is this something, you talked about this a little bit earlier, but is this something that we're going to be seeing more of? And if so, why?
I do expect that we're going to see more wildfires in the coming years and decades. And that's because climate change, unfortunately, is getting worse. Temperatures are going up. We also see people moving into what we call the wildland-urban interface. And so this is kind of that area where forests overlap with human settlements, and that can cause people to be even more exposed to these wildfires. And so I expect both the exposure itself, wildfires, to potentially get worse, but also people to live potentially closer to where the wildfires are actually happening.
Wow. So pretty much as we continue to build communities and stuff, we're kind of like intruding, I guess you could say, into like wilderness, is that what you're saying?
Exactly. Yeah.
And so if people are in areas where wildfire smoke is, what can they do to protect themselves and their families?
Yeah, great question. So if people are not located close to an actual wildfire where it's burning, but they're located somewhere like, for example, New York City during these recent events where there was a lot of smoke exposure going on. Things that can be done. Number one, stay inside if at all possible. Two, run an air filtration system if you can. You can actually build these now out of a box fan and filters for less than $150. And instructions for that are available if you Google it. Also, try not to overexert yourself. You don't want to increase your respiratory rate when the air quality is quite bad. If you're able to stay inside, try not to make any additional sources of air pollution in your home. So try not to burn candles, try not to cook with a gas stove, don't vacuum, which can stir up a lot of particulate matter in the home. If you're not able to stay inside, because like I mentioned earlier, some people aren't, I would really recommend wearing a mask. We are now pretty familiar with these, unfortunately, from the pandemic, but something like a KN95, an N95, even a surgical mask can help reduce the amount of particulate matter that you're breathing into your lungs.
And, with this conversation, we touched on so many good points. I learned a lot myself. What do you want the main takeaway from our conversation to be for our viewers who are watching?
It's a good question. So for me, with these 2023 wildfires, we've seen these plumes of wildfire smoke from Canada showing up in the US. It's demonstrated, I think, more than ever that we have this transnational or global problem that we're going to need to work on together to solve. I also want people to realize, unfortunately, this is not going to be the last time we see wildfire smoke. And so getting ready now, preparing for the future, having a wildfire exposure plan with your family and what you'll do next time air quality gets really poor from a wildfire is something important to think about now. Unfortunately, this is part of our lives going forward.
Thanks so much for watching Advocate Today. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe on our YouTube channel. For the Advocate channel, I'm Aaron Dean, and this was Advocate Today.